All right, time now to talk to Dr. Brian Talleur with the Aegis Treatment Center. He is the Chief Medical Officer, and we've talked to him in the past before.
We have.
He's back. Welcome back.
Doc, thanks for being here.
Thank you. Thanks for having me.
All right, so last time we talked, we're feeling, maybe we should be feeling a little proud and good that you're seeing some of the highest admissions that you've seen in a really long time at your treatment centers. This could be both a good and bad thing. Maybe the word getting out and more people are accessing the service they need. How's this make you feel about this rise in numbers?
Exactly what you said. This is encouraging and humbling at the same time. And there are a lot more people out there that need help and need treatment. So definitely encouraging and proud to be a part of the team.
That's great.
All right, you've talked about in the past, last time we talked, you discussed how that you treat opioid addiction and also methadone.
Yeah, so last time we spoke about methadone. Methadone is an opioid that is long-acting, and it's used with medication-assisted treatment. So it helps with the cravings and the withdrawals so that patients can go to counseling. Another medication that we use that I'd like to introduce you all to, you may have heard of, is buprenorphine, and the trade name is Suboxone or Subutex. And that medication is a little bit different than methadone. It's a partial agonist, so it partially stimulates at the opioid receptor, and you put it underneath your tongue. A little different than methadone, but definitely good treatment, has a very good safety profile. And we've become experts at doing inductions with buprenorphine with patients that are using fentanyl.
Wow, Doc, so this, obviously a little bit of a breakthrough, I would imagine, because it seems like with this type of addiction, this type of treatment, methadone has always been the go-to drug, and now you're offering another option, and you guys have quickly become the experts in it, as you say. That's got to be exciting for Aegis Treatment Centers.
Yeah, but we've definitely learned a lot. Fentanyl is a very, very difficult, challenging drug. It is so potent. Many people have heard this, about 100 times more potent than morphine. And it's also distributed in the body differently. It's very difficult to find, actually, oxycodone on the streets. The 30 milligram oxycodones, almost all of them are fentanyl. And recently there was a study done, and it discovered that the average amount of fentanyl in these pills was about 2 milligrams, which is a fatal dose.
Wow.
All right, we got one more question for you. Got time for this one too. If you've got a member of the family or a good friend that's suffering from alcohol or other type of drug use, can Aegis help them?
You know what? If it's a patient that's struggling with opioid use disorder and also another addiction, which is very common, patients struggling with alcohol addiction or methamphetamine addiction, we can definitely help them, and they should call us.
All right, Doc Talleur, thanks for coming in again. Congratulations on helping so many people. Hopefully so many more are going to seek out your services to get the treatment they need. Appreciate you. We're going to put up a little information, Dr. Talleur, so that people can find out where they can go for treatment, for more information. Website, Aegis Treatment Centers, of course, you can find it. They're located down in Canoga Park. Dr. Talleur, thanks for coming in from Aegis Treatment Centers.